So I was asked this question: what do you say about heavy periods in a 13-year-old? What can be the causes and what can be the cure? So this is going to be a long reply, so bear with me. The management of heavy periods is the same for everyone regardless of the person's age. We don't discriminate based on their age. At the age of 13 years old, or in fact at any age, the causes of heavy vaginal bleeding must be investigated. You can't ignore it. It can be due to many causes like a hormone imbalance between estrogen and progesterone. The most common causes are going to be dysfunction of the ovaries, so that's where the body doesn't ovulate or release an egg during the menstrual cycle, and this creates a hormonal imbalance and can cause heavy menstrual bleeding. This happens in polycystic ovarian syndrome, if you are overweight or have an underactive thyroid, that can also cause heavy bleeding. Bleeding disorders such as von Willebrand's or platelet disorder, which is when you have low platelets or poorly functioning platelets, can cause heavy bleeding. Sometimes structural problems in the actual womb, such as fibroids, polyps, and sadly uterine cancer, can cause bleeding, but thankfully uterine cancer is very rare in younger age groups. The other thing that needs to be considered is pregnancy. Although it's rare, really rare, but sadly as a GP, I do check and ask a 13-year-old in front of me if they are sexually active, and if they are, do a pregnancy test, although that's distressing when that happens. For a 13-year-old, once we investigate the cause by doing some investigations, the management is still going to be, well, as it stands for any other age group. I still offer tranexamic acid or mefenamic acid if they can tolerate non-steroidal anti-inflammatories. I offer the young person the oral contraceptive pill because heavy vaginal bleeding is caused by hormonal imbalance, so therefore we try and correct that with contraceptives where possible. The risks and benefits have to be individually assessed for each person, but what we mustn't do ever is put up with heavy periods that are affecting a 13-year-old or above, because their quality of life, their studies, their ability to take part in sports or have life or freedom of heavy periods is so important. And do not be put off if the doctor says, well, this is normal and this is what we're going to do. Sometimes I do a process of investigation and then targeting my treatment to that investigation. And it might mean a referral to the gynecologist as well. But all options have to be looked at. The most important thing is you don't put up with it.